Hi there, it's Dr. Susie New here, anaesthetist based on the lands of the Wurundjeri people of the Kulin Nation and COVID community doctor. You might have recalled in a previous video, I outlined the progress of COVID in some people. So here it is again on the whiteboard. This is severity on this axis, so how bad you feel, and this is time. And so some people are getting their initial symptoms during what we call the viral response phase. And a lot of people are then continuing to get better after that point, particularly those who've been vaccinated and young people. Now, some people will feel worse in the second week and then go on and mount this huge host inflammatory response and then can really deteriorate, need to come into hospital, maybe get admitted, come to ICU and be on a ventilator. So how do we predict who is going to deteriorate? Now, there's some fancy work by some very clever people looking at the biochemical markers, so the chemicals in your body that are produced during that early phase, and trying to see if those predict who is going to get worse. Now, as a doctor, particularly one who's ringing you up on the phone, I'm not able to access that sort of information. In fact, I don't think we're commonly doing that testing in Australia. So what I'm looking at is what your comorbidities are. So in this episode, I'm going to outline what are the comorbidities that we look at to try and predict your risk of deteriorating and needing to come into hospital and getting worse with COVID. So let me just change my whiteboard and come back and I'll go through them with you. Okay, so here I am with another whiteboard and a little bit of an outfit change. And before I want to go into the comorbidities, I want to talk about the risk factors that are associated with severe COVID. So I just said that these are associated, they're not causative. So there's certainly people who've had zero risk factors who've ended up in hospital with severe COVID. And there's people who've had 1, 2, 3, 4 risk factors and comorbidities and they've not ended up in hospital. So please don't panic. If you do have comorbidities or risk factors, it doesn't mean that you're automatically going to develop severe COVID. But please do use this as an opportunity to speak to a health professional if you do get COVID. Okay, so that's the first thing. These are associations. The next is that they're not black or white. It's not a ticker box exercise. So I'll try and go through the caveats as we go through. But it doesn't mean that just because you're, say, pregnant or you've got high blood pressure, that you're automatically going to fit into the category of having a significant comorbidity or risk factor. And finally, this may not be a comprehensive list. We're learning more and more about this virus all the time, so this list may change, which again is another good reason to speak to a health professional. Okay, so first of all, the risk factors. So being Aboriginal or Torres Strait Islander, being an asylum seeker or refugee, these are risk factors for developing severe COVID. Increased age is also a risk factor. Now the cutoff for that will depend on the different services. So it could be greater than 50, greater than 60, greater than 65. I put greater than 55 there as an indicator. Being pregnant might be a risk factor depending on how advanced you are through your pregnancy. And then also your vaccination status, whether you're not vaccinated, is a risk factor for developing severe COVID. Now moving on to the comorbidities. One of the most significant ones that I've seen is BMI, so your body mass index. I'm going to leave a calculator in the description below as to how you can calculate it. But basically, if your BMI, which is your weight in kilograms divided by your height in meters squared, if that is over 30, then you are in an unhealthy weight range and at an increased risk of developing COVID. For most people, unless you're way over 6 foot tall, so way over 180 centimeters tall, if you're over 100 kilos, then it's likely you'll have a BMI that's greater than 30. Okay, and then we've got the chronic diseases. So a chronic disease is one that is long-standing. And I've listed here the ones that affect most of the major organ systems, such as the heart, the lungs, the kidneys, the liver, and also the blood or hematological system. So again, just having a disease in one of these categories doesn't automatically put you in the higher risk group. So for example, if you have high blood pressure and it's been well controlled on one medication, we might not necessarily regard you as being in the higher risk group. And also if you've got hepatitis B or C and that's been very stable and you don't have any signs of chronic hepatitis or cirrhosis, then we might also put you into a lower risk category. I also put in the blood chronic diseases, or the hematological ones, if you've had a splenectomy in the past. So if you've had your spleen removed in the past, that may be a significant risk factor for developing severe COVID. I've also specifically highlighted these conditions. So immunosuppression. If you're immunosuppressed for any reason, then you are definitely at high risk of developing severe COVID. And hopefully I'll have another video coming out for you soon. Also diabetes and cancer. Now, not all cancers are associated with severe disease. So for example, if you've had skin cancers and they've been removed and they've been very stable, then that might not necessarily be a risk factor. And then last but certainly not least, if you've got a psychiatric or mental health disorder requiring regular treatment, specialist care, that might also be a risk factor for deteriorating. Note again that if you've got depression or anxiety and that's been stable, for example, well controlled with one medication, we might not necessarily regard that as being a significant risk factor. So what do we do with this information? Well, this information might be used to help direct you to particular aspects of the health service rather than letting you do self-care on your own at home. It might mean that we monitor you more frequently. That might be giving you regular SMS messages, maybe a daily or a twice daily phone call. You might have access to other things such as a 24/7 dedicated hotline. You might be sent an oximeter. You might be offered extra treatments, early treatments such as budesonide, which is an asthma type of medication, or even the monoclonal antibody therapies. So these are some of the things that you might be considered for. Of course, that will depend on what's available in your local area and perhaps what's been ramped up in response to the pandemic. Okay, I hope you found that useful and thanks for watching.